Hi, and welcome to Something to Talk About. I'm Linda McNamee, and thank you for joining me this evening. Speaking of thank yous, I would like to start by thanking my crew, or the crew here, because I kind of don't want to sound too possessive. I would like to thank Mike Duvall, who is a staff member here, and he really helps me out and makes me look good. And I would also like to thank Colleen Moore, who is a volunteer who gives up her Wednesday nights to come here and sit and listen to me talk for an hour. And I would like to thank you, the viewer. And I would also like to thank my husband, Paul, for staying home for Daddy Date Night. And hopefully you had fun beating Batman Lego and playing the Wii game that my daughter has now been introduced to. And she loves Wii, and she loves Batman and superheroes. And so Gwyneth and Evan and Daddy, I hope you had a pleasant evening, and I will see you in the morning. And if you have a question for this evening for our tonight's topic on depression, please feel free to call in. The number we can be reached at is 781-270-9199. Or if you think of a question afterwards, or you have an idea or suggestion for a future topic on Something to Talk About, please feel free to email me at talk@bcattv.org. Now that I have all the legal stuff and all the formalities aside, I would like to introduce Cheryl Carter, who is a licensed social worker and psychotherapist.
Licensed independent clinical social worker.
Oh,
it's very different than what you said.
I just go with the initials. Well, thank you for joining me.
Thank you for having me.
And I've gotten a lot of comments already on the show, and we haven't even recorded yet.
Wow.
Because it is the dead of winter. It is bitterly cold. It gets dark at 4 o'clock.
Yes, it does.
Everybody is kind of like, okay, I am so done with winter. Mm-hmm. And it does get to be depressing.
Absolutely.
So anyway, on a cheerier note, thank you for joining me.
My pleasure.
And can you start out by telling us a little bit about yourself, where you grew up, how you managed to find your way to Burlington, unless of course you grew up here, which we'd like to know too, and what made you interested in studying psychology?
Okay, I would be happy to. I'm all about openness as well. So I grew up in Maine in a typical dysfunctional family in Maine, and moved to Massachusetts right after high school. I had always been interested in the field of psychology, mm-hmm. but I also loved theater and singing and musical theater. So I actually went to school to Emerson to begin studying musical theater.
Okay.
And not so much with the musical theater. Still sing, but
okay.
not so much with the theater part. So it wasn't exactly my forte. So I ended up switching my major there and ended up being one of 6 graduates with the degree in psychology from Emerson, which is a communications school. So not many people are going to study psychology.
Okay, but they still have the coursework available.
Mm-hmm.
That
So
that's convenient.
Yes, and I got my master's, my master's in social work from Simmons.
Okay.
Prior to that, I had done some work in the field. I worked in a treatment facility for DYS associated adolescent girls.
Okay. That's a tough crowd.
Yeah, absolutely. I did a lot of volunteer work, and so I really just loved what I was doing. Mm-hmm. And so then I went to get my master's in the field, and then after that so I moved to Burlington about, I would say in the mid-'80s, my husband and I, and we've been here ever since, and we have 4 children, 25 to 15, lovely children.
Not exactly children anymore.
Well, I'm having
okay, they
a
might
hard
act
time.
like it once in a while.
I'm having a hard time letting go, I really am. But they're all basically still home.
Okay.
One of them's in school, but he's home often. And one of them, my oldest, is actually an actor. He does a lot of community theater in the area, and then I have 2 in high school. So I took quite a bit of time off to raise my kids, but I still loved the field so much of social work that I volunteered. My husband and I struggled with infertility for several years. And
That makes
so,
you depressed.
Absolutely, absolutely. And I did some work for what was then called Resolve of the Bay State, which is an organization of people who struggle with infertility.
Oh, okay.
As an advocate and a counselor.
Okay.
And I've worked at the AIDS Action Committee in Boston.
Okay.
And I did, my husband and I did some work at, volunteer work at the Special Olympics. So we
Wow,
kept
that
a
must have been
hand in,
fun,
yeah, it was
yeah.
very fun. We kept a hand in, and I kept a hand in the field while I was raising my children. But while I loved raising my children, I really missed being, you know, in the field. So I then, about 12 or 13 years ago, got back into the field. And
Okay, so your kids were still pretty young at that time.
yeah, my youngest was about 4 or 5.
Okay.
And I said, you know, I need, like, I've done my time. Do you know what I mean? I've loved it, but I need to do something more. So got into the field, and then found, well, I worked in a homeless shelter for women for a while, and then I got a job in a mental health clinic in Lowell, where I was at for over 10 years.
Wow.
And that was really where I got it was a major good training ground for
Baptism by fire, it sounds like.
absolutely, for
Wow.
just working with the most challenging cases, the most challenging populations, the most challenging disorders, mental health disorders, under some of the most challenging of circumstances. And I absolutely loved it. And then the situation changed, and it just became, I mean, not to sound, I don't want to sound whatever, but the paperwork became sort of almost more bigger than the
Okay. Yeah.
work. And I said, yeah, not so much. I think I'm ready for something else. So I for the last year, almost a year, have been doing work in a private group practice.
Oh, okay.
And so,
Somebody else can do the paperwork.
right, and I've been, you know, just basically running my own business, and
Okay.
and again, it has been in Lowell, and that has been, you know, just so satisfying, and so that's how I came to.
That's how you're here.
Yes, it is. It's how I'm here,
And you're still smiling. I
and
like that.
I just can't say enough about how incredible it is. And I've had people say to me, friends of mine will say to me and have said to me, I wouldn't last 10 minutes across from someone with that kind of a problem. Do you know what I mean? Across the table.
Right.
How can you stand it, you know?
Well, I'm kind of curious how you can leave the job at the job and not bring it home with you.
I don't know how I do it. I think I use a lot of coping techniques that I've learned.
Okay.
It's kind of hard to bring the job home with you when you have, you know, 4 kids and 4 or 5 pets, you know, just on you. Do you know when you're home? It's a huge distraction.
Oh no,
so,
I've never had deal with children wanting my attention.
you know
Never.
what I'm saying, and a traveling husband, which makes it even that much.
Ooh,
So I really
wow.
have to. I'm good at focusing and compartmentalizing. So. I'm sure I have, according to my kids, would tell you that, oh, I have taken the job home with me. Do you know what I mean? But for the most part, I'm really very grateful for the break, the break of the job, the break of home.
So tonight we were going to kind of focus on depression. What are some of the signs of depression? Because there's just kind of having a bad day, and then there's being depressed.
Right.
How do you tell the difference?
So according to the new and revised and improved edition of the DSM-5, which is the Diagnostic Statistical Manual for diagnosing mental health disorders, there's a set of symptoms
Okay.
that if you have 5 out of these symptoms for 2 weeks, you can be diagnosed with depression, with major depressive disorder, it's called. And there are several different types of depression.
Okay.
But that's the most acute form of depression. And the symptoms would be feeling empty inside, sad, loss of pleasure, loss of the ability to experience it, and loss of ability to anticipate having pleasure. Worthlessness, helplessness, guilt that can become delusional, quite delusional. It's another word for that. It would be irrational guilt.
Okay.
Insomnia, hypersomnia, weight loss, weight gain, irritability. What else would there be? I think that was more than 5.
That sounds pretty
like
complete.
a lot, yeah.
Now, you mentioned 2 weeks, and I know we're going out of the order
That's
of my
okay.
cheat sheet. What about seasonal depression? Because I've heard so many people being depressed in the wintertime. So how does that affect all of those symptoms in the DSM-3 or DSM-5? Sorry.
How does it, you mean the change in season?
Yeah, how does the change in season, is it still depressed if it's during the winter, and can you become undepressed in the summertime?
You know, I have had clients through the years who have complained of seasonal affective depression. It tended to happen more often in the onset of fall. For some reason, more than winter, although I know it's known for being a wintertime thing. But you would treat it like you would treat depression. It has the same diagnostic criteria. And a lot of people would add something like, light therapy.
Oh, okay.
A light box or whatever.
Yeah, I've heard of those, light boxes.
And people swear by them. They really, really do feel help. A lot of people have felt helped by those tremendously. So I think some people tend to maybe, instead of being, sort of lifers on antidepressants, they might just do it, they might go on an antidepressant for that time period. And then it gives them the needed lift and relief. And then they might go off of it for the rest of the year. I've heard that, and I know there's lots of different beliefs and opinions about that kind of
There are lots of
therapy.
different opinions in everything.
Right. That's
Not
true.
just- Okay. Are there different kinds of depression, or is depression like a one-size-fits-all type?
No, there are different kinds, and so there's major depressive disorder, which I just described.
Okay. There's like postpartum.
There's
That's pretty common.
Yeah, and I'm dying to look at my notes right now because the names have changed recently in the DSM because I'm busy practicing, treating therapy. I haven't had a lot of time to read up because it's a 1,000-page reference book. So it's going to take some time. But there's disruptive mood dysregulation disorder that occurs in children.
Okay.
There's the postpartum.
Okay.
There's premenstrual something disorder, depressive disorder, which is probably pretty self-explanatory. There is substance abuse induced depressive disorder, and depressive disorders that are induced by medical conditions. So there's
a lot out there.
There is.
So it's not one size fits all.
Right.
Now, I too in the past have been treated for depression, which is kind of why it's been an interesting topic for me. And people used to tell me, oh, just snap out of it. Or, I felt like it was a weakness of mine. Is it really a weakness?
It's not a weakness, although many more people used to think of it that way, and many people still do, but many more, I think there's more acceptance.
It's become a little more socially acceptable.
Right. It's not a weakness at all. It's a biochemical, misfiring in the brain. That's, things are just really not right biochemically. And, it needs to be treated like, and I think part of the problem are when people have disabilities that are invisible, it's much harder to empathize. It's just much harder to empathize with that person. You can't see it. Do you know what I mean? So, and that combined with our, our whole American way of, self-reliance and suffer in silence, pull yourself up by your bootstraps, be stoic, blah, blah, blah. It's
kind of socially ingrained into us that, if you're not perfect and not really, well, nobody's perfect, but it's like it almost is taught to us as being a sign of weakness.
Absolutely.
So,
As are
you
all
know, and
mental health disorders.
you just can't snap out of it. It's just you know,
Right.
trust me, if I could, I would.
Exactly.
So is there like, I don't want to use target audience, but is there like a general age range that's more susceptible?
So you and I have both read that 18 to 39
Yeah.
seems to be a group that's fairly
Yeah. I don't want to say target audience,
vulnerable
but that's like
or
the wrong
whatever,
term,
but you know, babies can be depressed, children can be
Wow.
depressed. Puberty is a susceptible, you know, sort of sensitive time. Later teens, you know, transitioning, you know, life transitions, college, marriage, children, aging, stuff like
Okay.
that, health problems, changes in your life, you know, moving, blah, 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 stuff like that. It can all, it's all hard. You know, it's all hard because
Yeah.
it all involves.
well, we are
all-
creatures of habit
Yeah,
too.
and all of
so-
it involves some type of loss. And when you have some type of loss involved, you know,
Now, is it usually triggered by one of these things, or
a depression.
a depression like normally triggered by a moving or transition to school or?
I mean, I don't know that most people that become depressed are depressed by something that's that sort of like a rite of passage that
Okay.
most people do go through.
Okay.
I think people that are vulnerable to depression or who maybe are already depressed go through
okay.
something like that, and it will worsen.
Okay, and that's when it could be like
But it's
more
usually
noticeable.
something a
Okay.
little bigger than that, you know, something a little more traumatic,
like losing your job or
you know, childhood abuse and neglect. Sexual abuse is, you know, absolutely soul destroying, you know. You're going to be very, very depressed at things like that. You know, natural disasters. I work with some vets, you know, they
like
come back
post-traumatic
from
okay.
active duty, and that is PTSD. But they're also depressed, you know, very, very depressed. You know,
Gee, I always thought they were kind of the same thing.
they're very closely related, but they're not the same
They
thing.
usually go hand in hand. Well, I don't know.
No.
We don't have to go into this.
No, it's okay. Depression is way more common than PTSD.
Okay.
Yeah. About 17 million people a year will have an episode.
Oh, wow.
So a quarter of the female population
Okay.
and an eighth of the male population in any given
So
year.
it tends to be more popular in women?
It's more reported in women.
Okay,
Don't know if it's
there we go.
underreported by men. Yeah.
Because we go back to the whole social, be strong,
absolutely.
boys don't cry.
Exactly.
you
They
know.
have way more pressure, a lot more pressure on men to be stoic and to not be open with their feelings, to not feel
And
comfortable
also seeking
expressing.
treatment too. Because I have a friend of mine, and all signs lead that her husband is clinically depressed, and he just refuses to accept it.
Right.
So,
That's very sad.
and I think it's because he was raised in this is what men do, this is what boys do, this is what men do,
Right.
and it's a sign of weakness, and you can't, So,
That's a
anyway, I
shame.
digress. So, what are the treatments to make things simple? You mentioned that there's a wide range of different kinds of depression. So let's just stick with what was the
Major
common
depressive disorder.
Yeah, major depressive disorder. Just for simplicity's sake.
Yeah.
What are some of the treatments for that? Can diet and exercise kind of fix it, or do you have to go on medication or?
So the most successfully tested treatment, the treatment that's been shown to be the most successful
Okay.
through testing, has been a combination of meds and talk therapy.
Okay.
And that's for major depressive disorder.
Okay.
For persistent depressive disorder, which is the dysthymia, I'm not even sure I mentioned that.
Not
Did
yet.
I mentioned, okay. That's one of the depressions,
Okay.
which is less acute but more chronic,
Okay.
which you have to have for a year as a kid and 2 years as an adult
Okay, so
to be diagnosed
So
with
the
it.
dysthymia is more
Dysthymia.
sorry.
It's okay.
One of those SAT words. That's more of the just really feeling blue.
Yeah, like sort of if you saw someone with it, you may have met sort of a sad sack.
Yeah.
That's
Somebody
maybe
who wants to
someone-
stay in their pajamas all day and curl up under a blanket.
just a mate from mildly to a little more than mildly depressed person who does not experience the functional impairment to the same level as major depressive
Okay. Okay.
disorder.
Okay. So it's like
They're
an
more-
intermediate
Yeah,
step
yeah.
in the
Right.
severity, but
So they
it just
may
lasts
do.
a lot longer.
So they may do okay. They may do better on either medication therapy or talk therapy. They may not need both.
Okay.
So that's different than major depressive disorder.
Okay. But most of the time they do go hand in hand. The talk therapy and
The meds.
the meds.
For major depressive disorder,
Right.
I hope so.
Okay.
Yeah, that would be my. And people there are people that disagree with me. There are people that would think, well, just the meds is the only thing you really need because it really does help a lot. And there are some people that think, the talk therapy will do it.
That's what girlfriends are for.
That's right. Exactly. That's part of why girlfriends do
Exactly.
talk,
Yeah,
because it
Margarita
does help.
night.
It does
We go out
lift.
and-
It releases endorphins. And it helps. So that's what I think. So
Okay. Now, is depression generally accompanied by other anxiety disorders? Like people who have panic attacks, do they tend to also be depressed or?
So my experience has been that most of my clients that have been depressed have not just been depressed.
Okay.
That there's been some other condition, some other disorder that they've struggled with. And I would say, since depression and anxiety are the most commonly treated
Okay.
disorders, that they tend to go hand in hand, but not always.
Okay.
You can come in and just be really anxious,
Okay.
but not really be depressed. If you're psychotic,
Okay.
a lot of psychotic people don't feel depressed. They're too psychotic to feel depressed. You know what I mean? So, yeah, but depression and anxiety are the most commonly, treated.
Okay. I think a lot of these we've kind of already answered. I love my cheat sheets, but sometimes they don't help. Now, if someone is being treated for depression, can depression be cured like low blood pressure or high blood pressure can eventually be regulated and, diet and exercise can change it? Can depression be cured?
I've never heard of anyone calling it cured.
Okay.
We call it being remitting, being in remission,
Okay.
and being treated. And you can have a depression and one and never have another one.
Okay. Now, is the remission when you're, if you were on talk therapy and medication, would there be a point in time where you could come off the medication and stop seeing the therapist and is that the remission? Or is remission just, I'm
I
not
think it's
depressed anymore?
relative because I think that you could be in remission from major depression and still be on meds,
Okay.
and having that be the thing that's sort of helping you to stay.
Okay.
Do you know what I mean? Yeah, what were you?
No, I'm just wondering, like,
I can't remember
if
what you just asked
someone's
me.
being treated for depression, are they basically, so if I were a client of yours,
Mm-hmm.
would I be seeing you for the rest of my life? Or is there a time in my life where there's a chance that I'd be okay and I wouldn't?
It depends on the acuity and the chronicity of your
Okay.
depression, how acute it is and how long you've had it.
Don't you hate like these black and white questions? What about this or this? Oh, well,
Not at all.
Is
I
it
will
A or
tell
B?
you that I've had people who, and if you let me just digress, and if you have someone who's depressed for a short period of time, and it's
Okay.
related to something
So
going
like the
on,
2-week thing.
it would possibly be diagnosed differently than depression. It might be adjustment disorder. Something's going
okay.
on differently in their life that is messing with their functioning, their
Okay.
level of functioning. And you would treat them, and hopefully and the situation would improve,
Okay.
and then they would go back to their base, level, their do you know what I mean, of
I think so,
functioning.
yeah.
So
Okay. So they kind of dip down and then
Mm-hmm.
gradually, when that transitional period or
clears up or gets better
Okay.
or whatever. But I have worked with people for years, the same clients for years, because they're chronically, they're chronically depressed, but they're chronically depressed and a lot more. Do you know what I mean? They've got
Yep.
just, dual diagnoses
Okay.
going on. They've got
Okay.
all kinds of things going on. So, not just depression, but depression can be tough. It can be really tough to sort of crack that code.
Well, because it's kind of hard because, something like high blood pressure.
Mm-hmm.
Well, there's like a concrete way to measure it.
Mm-hmm.
Depression, there's no concrete methodology to figure it out. I mean, everything's like subjective.
Right. It's not as It's not as scientifically
Right.
measured or whatever. I understand.
Does that make sense? Sort of?
I think so.
Okay.
Well, to you and I, it does.
Okay, moving right along. Okay, we mentioned dysthymia. Dysthymia.
Yeah.
That is that intermediary kind of
Yeah.
gloomy
Yep.
Eeyore.
Yep. Absolutely.
Okay.
That's it. Yeah.
So he just kind of goes on.
The glass is. It's a little worse than the glass is half empty, but
Okay.
yeah, the glass is half empty kind of person.
Okay.
And
I was just trying to think of like some character, I'm thinking Charlie Brown.
That was
well,
a
no,
good
not really
one.
Charlie. Eeyore.
that was a good one.
My son is on a Winnie the Pooh kick, and we've been reading Winnie the Pooh books.
In fact,
watching-
Winnie's probably got a little bit of that going on himself, from what I remember from Winnie the Pooh. Is he a little? Can he be a little
Yeah, he can be.
bit?
Unless he's got his honey.
there you
Yeah.
go.
He's got an eating disorder.
He has an eating
He's
disorder.
got an eating disorder.
Yes, he does.
Yeah.
Oh, so
Kind of like the binge
that's
eating.
a mask. Sometimes that's like a
Yeah,
mask
there
for
you go.
depression. So
And Piglet, we're not even going to go there.
let's not go there. Let's not go there.
Okay.
We love Piglet.
No,
You,
Oh.
No, you said, can someone snap out of it? Well, they can't snap out of it. They can do a lot of things for themselves
Okay.
to help themselves. There's a lot of things that a person can do.
because like one of the characteristics or qualifications, or I'm not sure the terminology, was irrational thinking and the irrational guilt.
So cognitive
like-
behavioral therapy techniques
Okay.
can help a person to.
But you just can't stop thinking what you're
and
thinking.
that's called thought stoppage. And yes, you can do that with a lot
Wow.
of practice, self-affirmations, progressive muscle relaxation. And the wonderful thing is, while you're helping your mental health, it's mind, body, spirit, you're helping everything. So if you have high cholesterol, if you have high blood pressure, it's going to get better as you tend to the depression.
Oh, okay.
Just like if you tend to a medical disorder,
Kinda
the
like a big
depression
picture.
will get better. It's
Oh,
just
okay.
it affects all
Well,
of
because
you.
a lot of times you get depressed because you have all these physical
Absolutely.
ailments.
Absolutely, and that's where the elderly are vulnerable to depression because of the later in life disorders that
Okay.
they have, that they experience. So
Now, could that also be not only all of their medical issues, but their world around them is changing,
It's all
friends and
about
family
loss.
or
I'm telling you, life, from one vantage point, from one angle of looking at life involves loss. And loss makes us sad. and some people get too sad,
Okay.
and loss is hard. Bereavement is grief over loss. Depression is disordered. You know, taking grief to the next level.
Okay.
It's
So you're like lacking a coping mechanism or something, or you just
in with depression.
yeah.
Do you need better coping mechanisms when
Yeah.
you're depressed? Absolutely.
Where do you
Absolutely.
get those?
Well, you get them from
Therapy.
from self-help groups, from therapy. I mean, I don't know. I think there's so many things that I have done to treat people with depression,
Okay.
and I'm sure there are many things that many other therapists have done, I have to say most of my clients in my experience have, responded to a lot of them to a certain extent. Some of them really, really nicely, and some of them
Okay.
somewhat. Do you know what I mean? But they're better
Okay.
just for having tried it and gone to therapy. It's sort of the corrective emotional experience of having someone non-judgmental who's going to sit with you and be with
Okay.
you. And
So is it better to have like somebody who doesn't really know you to be a better person to give advice because they can be more objective?
it depends on who the person who does know you is.
Okay.
If it's a former abusive parent,
Probably
Yeah.
not the best person to go
it's
to.
probably better to have a therapist or someone else. If it's a very trusted member of person in your life, someone that has given great previous advice, then go for it. But I have had a lot of therapy in my past, and one of the most amazing therapeutic experiences I had was after having a postpartum depression myself, and I met with a psychiatrist in Newton who did therapy, which most psychiatrists don't do therapy. She
Okay.
actually did therapy, and you could
Wow.
call it psychoanalytic. It was definitely sort of Freudian, except I sat upright during the therapy. And I actually met with her because I was really into it and I wasn't working and I had the time, twice a week for like
Wow.
several years. It was like phenomenal. And not that I hadn't had therapy prior to that, but she was all about opening my eyes to accountability. Really just helping me to grow up and take responsibility and becoming more accountable. And in doing so, it alleviated so much depression.
Wow.
And that's not all she did. She was also
Yeah.
very supportive and very kind and blah, blah, blah. But super smart person. I learned more from her about how to be a therapist than all my schooling and all my everything, all my experiences.
It's just a good example.
It was
yeah.
just phenomenal. So I'm so
Wow.
grateful for that. So, yeah,
So you just
Yeah.
have to find that right,
the right fit.
the right fit.
Yep.
Which I will have a question later on about finding the right. Well, actually, let's talk about it now. Why
Do
why
it.
not? How do you find the right therapist? Because there's so many. You mentioned the Freudian, the Jungian, or Carl Jung. I forget all the other ones.
that's
Erickson,
gone.
I think,
Yeah.
going back 20-something years from when I majored in psychology. There's so many different styles out there. There's so many different personalities out there. There's so many different, the bedside manner thing. How do you find the right therapist? Do you
Right.
just end up going shopping and picking a name out of the phone book, or?
So, my belief is like everyone in the workforce in this country, or probably anywhere in the world, most workers in a place that are of average skill.
Okay.
Some are below average, some are above average, but most are average.
Okay.
I don't want a therapist that's average. I don't mind.
Really don't want one below average.
I don't mind a cashier at Shaw's being an average. I
Yeah.
don't want a therapist who's average. I really need them to be really on point. So once you've talked to your doctor
Okay.
You've gone on insurance referral thingy,
Okay.
you know, and looked that up. Word of mouth, talk to your friends, talk to whoever.
Okay.
I wouldn't go to the yellow pages or online and just pick a name. Do you know what I mean?
Yeah,
You might
it's
as well
kinda
do it
dangerous.
blindfolded if you're going to do it. And then I would do an interviewing process of
Okay.
going to them and saying, I'm going to interview you to see if you might be a good fit for me for therapy.
And they let you do that?
Absolutely.
Hmm.
Absolutely. They
Okay.
they want a clientele, they want a caseload. So, and so that's what I would do.
Okay. Now, what happens if you meet with someone and it's not a good fit? Just try someone else? Go back to the word of mouth and
Yeah.
referrals?
Absolutely. Yeah.
So, my last show was in networking, so it's all in who you know. See, networking aspect
That kind of
affects every aspect of
absolutely.
our life.
Absolutely.
Okay. You had mentioned that you, I guess, fell victim, I'm not sure if that's the correct term, of postpartum
Yeah.
depression. I know I experienced postpartum depression. What causes it?
So I know that it's biochemical,
Okay.
and I know that it's hormonal, and I know that again it's a transition in life which involves loss. So here you are faced, and that's what that
Okay.
I understand is that part of it.
Okay.
Not the biochemical. I'm not a scientist. Blah blah blah. You know what I mean?
Right.
So the loss piece is so painful because you know you have this brand new baby and it's like it's like everyone's expecting you to just be the happiest human being alive, and you're not. You know, you're not. You can feel very alienated from the baby. You can feel very alone in the world. You can feel very anxious. I was really anxious. I had a hard time sleeping, and I had a tough labor and delivery, and that
Oh, okay.
also influenced the chain of events. But it was just very, very painful, and
And babies don't come with an owner's manual
They
either,
don't.
so
they don't. And,
Like,
and
what am
it's
I supposed
trial,
to do
it's,
with this
it's like
thing?
constant trial by error.
Yeah.
But a newborn is just, my God, it's like 24/7.
that's why you have a second kid, because it's trial and error on the first. Second
Right.
kid will come out much better.
Yeah, except it happened
Yeah, well, anyway.
in reverse with me, but whatever. And so I was in so much pain. I was in so much pain. That's where I met my therapist. And I remember someone from the hospital recommending me to go to a support group for, it was either a
So you
support
kind
group
of
or
knew
a therapy group.
right away that there was something going on.
And not only did I know right away, but sadly I
Well, you had
reached out to my OBGYN for assistance,
Oh, okay.
some kind of assistance prior to the birth,
Oh, okay.
and it was not really heard. I really wasn't heard. So I
Oh,
sort
okay.
of knew that I was going to just be floundering for a little while. And but it wasn't too bad because right after the birth I got, you know, much needed help. And
Okay.
but I remember being referred to a group. It was either a support group or a therapy-led group. I think it was a support group for women with postpartum depression.
Okay.
And I was just, we were talking, and I said, you know, I feel such irrational guilt. I didn't know it was irrational at the time about, you know, not being thrilled to be a mother right now, and you know, the tears, and I just feel like, you know, what you know, a failure. I felt like a failure, and then I heard a woman say, so this was new territory for me. I heard a woman say, I just keep trying to stay away from the sharp knife drawer.
Wow.
And I said to myself, not sure this, it was so scary to me to hear that somebody
Yeah.
could be that sick, that at the time I really wasn't able to handle continuing in that group. Now I would, you know, be honored to treat someone that was that sick with postpartum depression, but at the time, so there's a wide range. It's quite a spectrum
Okay.
of, you know, from the blues to psychosis, and you didn't really ask me about that, but I thought that was kind of
Well, no, I'm also,
interesting,
not trying to divulge all of my issues, but
Yeah. So let me divulge mine.
Yeah.
So you can just.
But it's like a lot of this is
It's-
sounding very common.
Yes, absolutely. And it is very common. Don't ask me the statistics on it. I do
No.
not have any. I don't know. It's
I wouldn't remember the statistics anyway by the time I left here. So anyway, with postpartum depression, it's triggered by the birth of a child. How long does it generally last? Do women tend to, recover from the postpartum, by the time the kid's in college or whatever? Or does it tend to turn into the regular depression?
Major depression, yeah. So if untreated,
Okay.
it can get worse and just become
Okay.
depression. I
Okay.
mean, and oftentimes it's delayed, the onset. It doesn't feel experienced by the woman until maybe 6 months to a year after the birth of the child.
And that's still considered postpartum?
Mm-hmm. Yeah.
Okay. Thought by that time all your hormones were, kind of back in line.
And so, no, your hormones take some time to get back in line, from what I understand. Yeah, so it definitely can turn into a major depression. And it really, really needs to be treated because there's stuff wrong on so many levels. Do you know what I mean? Not just the change in life or whatever, but also the chemistry and the hormone, all that stuff. So.
Okay,
So-
now you mentioned in one of the groups that you were in that one person wanted to avoid the knife drawer.
Mhm.
What is that common for depression to get that bad where somebody actually starts thinking about harming him or herself or others? Can depression be caught before it gets to that level?
It almost always is.
Okay.
Yeah, it's only 4% of clinically depressed people, I
Okay.
believe, will attempt to harm themselves, will attempt
Okay.
suicide.
Now, what about thoughts of suicide kind of getting in the picture?
I think I don't remember reading up on that,
Oh,
but
okay.
I'm certain that there's a lot more of that going on than attempts.
Okay.
But women make more attempts at suicide, but
Okay.
men complete more attempts at suicide.
Okay.
It's still, and it's horrible, but it is a very small percentage of people with, major depressive disorder,
okay.
and it almost always features a lot of other stuff going on with it.
Okay.
Substance abuse,
Oh,
stuff
okay.
like that,
Mhm.
medical conditions, bipolar disorders.
Now, is bipolar the
closely
same
as-
thing as manic depressive?
Mhm.
Okay. So you're really happy one minute and then you're really depressed in the other.
And it's not necessarily happy. It can be happy, but it's often
Hyper.
just a really irritable manic. Just a
Oh, okay.
really, really unsettled, pressured speech, racing thoughts,
Oh, okay.
irritability, mood swings,
Too much caffeine?
like on steroids. Do you know what I
Oh,
mean?
okay.
It's because it's so at risk. The manic phase is so at risk for major consequences to behaviors because there's so much potential for acting out.
Okay.
Compulsive spending, shoplifting, just doing very erratic things.
Okay.
You can imagine relational issues and relational dynamics that would come into play when someone's actively manic.
Okay.
On the other hand, so many famous people were bipolar, have been or are bipolar. So many incredibly creative people are
Okay.
bipolar. So with the mania comes oftentimes this feeling of tremendous creativity
Okay.
and free-flowing thoughts and ideas and blah, blah, blah. And in my opinion, in many people's opinion, those people are lifers on meds.
Okay.
And I've
Sounds like they kinda
done a
have
lot
to
of
be.
work with bipolar people, and
okay.
it's very. I think it's kind of getting overreported now, or overdiagnosed now. But
Okay.
Um,
Now, we've touched upon medical issues. What kind of medical conditions tend to be more prone to attracting, not the right word, but more prone to those people getting depressed? Like a cancer patient.
Absolutely. Cancer, a heart patient, someone with traumatic brain injury, an elderly person would be at risk for something with like Alzheimer's or Huntington's or Parkinson's. Those are very highly, go very closely associated
Okay.
with depression. What else?
Now, are they still treated pretty much the same way as?
So I can't remember the specifics, but I know that with elderly, which I don't work with,
Okay.
there are more complications and more concerns, potential complications and concerns for the use of antidepressants in treatment of depression.
Okay.
So, I'm sure I don't know more than I do know in the
Okay.
treatment of the elderly with depression.
Okay. Because I'm just thinking like a cancer patient who's going through chemo
Mm-hmm.
and taking the anti-nausea medicine and taking the pain medicine and taking everything would obviously, depending on the level that cancer patient is, they might become depressed, but taking antidepressants, what's the,
Is
there
it
generally
safe?
drug interactions?
Yeah, no, I think it's
or-
pretty safe.
Okay.
Because I have worked with
I'm
cancer
not really sure how the brain interacts and all
Yeah,
that kind
I
of
don't
stuff.
either. I don't know either. But I know the cancer patients do. I've worked with cancer patients. They're on antidepressants, and they desperately need them to be able to feel somewhat stable. And I've had a lot of family members with cancer who have been on antidepressants who need to be on their antidepressants and also
Okay.
their anti-anxiety meds because going through that stuff, chemo. and-
Understandably, I don't mean
Absolutely.
to, downplay it because it is a very
No, it's
serious.
horrific.
Yeah. Okay. Boy, this is a real cheery show, Linda. Who are you gonna have next time? Okay.
A clown on next time.
Juggling. Who is my next guest? Oh, anyway, we'll get to that later. Psychotic depression. Did we talk about that yet?
I think I just mentioned
What
it
is
in
psychotic
passing.
depression?
It's depression with psychosis. It's very simple.
Okay.
It's depression with delusions, hallucinations,
Okay.
auditory, visual,
Do they tend-
tactile.
Do those tend to be drug induced or if
They
somebody's
certainly could
chemically
be.
okay?
You mean, is there a drug-induced psychosis? Absolutely.
I'm just wondering if it's the drug that induces it or
You mean which drug?
any drug.
So
So somebody does not have to have a substance abuse problem in order to
be psychotic?
be psychotic.
No.
Okay.
Most people who abuse substances aren't psychotic.
Okay.
Just like most people aren't psychotic, but there are a number of people that are,
I'm just throwing
psychotic.
things out there.
No, it's fine.
I'm just throwing things out
Appreciate
there.
it.
Why not? Okay. Here's that question. I knew I had this question in there. How often does depression get severe enough for the individual to contemplate suicide? You said there's only like 4% of
Right.
people who actually attempt it,
Right.
but that's actually
I think
yeah,
that might be who complete it.
complete it. Okay.
That's what I think. Yeah, but it's it's attempted more in women, which surprises me.
Okay.
But there's a completion in more in men.
Okay. Well, the attempted more statistics you can show whatever you want because earlier in our conversation we said a quarter versus an eighth of was it a quarter of women are depressed and an eighth of men are reported. So a quarter just
Right,
thinking,
you're
by
saying
the
just-
time you
It's a crossover. It's like
it's a crossover
Right.
and
I know what you're saying.
it might not be actually equal audiences and equal groups that you're
Right.
starting with. So
And men succeed at suicide usually because of their means of suiciding.
women are just too gentle, too caring. Anyway, boy, this is getting really depressing.
I'm sorry.
It's okay. No, okay, here we go. Treatment options. If someone suspects that they or a friend, family member are depressed, what's the best action to take? Or what are some
So
Or what's the first action to take?
so if they have the kind of relationship where they can talk,
Okay.
if they have a trusted relationship, then the person could speak to the identified patient or
Okay.
whatever. And then if it's non-productive, they could, talk to a doctor, talk to their doctor, talk to the person's doctor.
Okay.
It depends on the relationship,
Okay.
who they would speak to. Clergy, teacher, other friends, siblings,
Okay.
parents.
Just because it's like you want to help this person, but if they are of the mindset where, oh, depression's a weakness, I can't
Right.
have
If
that.
they're in therapy, certainly talk to the therapist if
Yeah.
you have a concern,
But if you want to get that person a therapy, what are some of the options to take? Approaching the individual, as you mentioned, approaching
It's
a clergy
very
member.
painful to realize that you cannot control another person's.
Talk to the doctor. I
decisions
kind of
and-
like that because then the doctor can approach it from the clinical point of view and ask the questions. And
Yeah.
I like that idea. And we kind of also already talked about advice for finding the right therapist and the right treatment options because it is really individualized and it's not a one-size-fits-all.
Right.
Okay.
Absolutely. And someone that I might consider to be, just a stellar, practitioner, someone else may experience them as being really, sort of lacking in some way.
Okay.
So it is very subjective.
Okay. We still have some time left.
Oh my
and
God!
I went
can
through
we
all of my
please
questions.
Tell jokes
So,
for the last few minutes.
Yeah, let's cheer
Oh,
something
can you
up.
cheer me up because I have just depressed myself so. No.
We
I've
need to go have
depressed
some
you.
chocolate.
I know. Exactly. That's a major.
This is
That's a good
so
thing.
chocolate's good for you.
In very
Dark
small,
chocolate good for you?
yes, absolutely.
Okay, it probably doesn't help the thighs.
Tell me about
but
it. Yep, piece of chocolate when you're premenstrual does the trick.
So what about like the Twinkie defense?
I shot him
wh-
because I was on
Craving Twinkies because I think just the urban myths and everything, trying to lighten things up because you had mentioned now that PMS could be a cause for depression or there's a type of depression
actually,
with PMS.
Premenstrual something disorder. Remember, it's new. The wording is new to me.
Right.
But I have it written down. But it's the onset is right after ovulation,
Okay.
and it remits right after the menses.
Okay.
So it's basically what was that? What was the name of that PPD, premenstrual something or other disorder? I don't know.
Okay.
I should know it. The disorder,
Okay. I just remember like a long time ago, like 20 years ago or
Okay.
something, somebody was acquitted of murder because they blamed PMS for it. And then somebody
Wow.
else said the Twinkie defense came up because somebody was deprived of,
Twinkies.
they ate too many Twinkies or something.
And did they get
or-
off?
I don't remember. I just
Okay.
remember hearing the phrase the Twinkie defense.
Oh, that's
and
funny.
It was related somehow to,
Well, it sounds absurd, but
I know.
But
But if you have a good enough
PMS
lawyer, if you have a good therapist, you get
Absolutely.
a good lawyer, and you can do just
absolutely,
about
absolutely. Oh, absolutely. And I can't say enough about a good therapist and finding one. They
anything. So
can
word of
make
mouth is the best way to go.
all the difference in the world. It really can.
Okay. Any catchphrases to try getting that reluctant person to be aware of the patient who refuses to admit that they're a patient or that they're depressed? Any catchphrases? Any?
So someone that came in to see me wouldn't
or actually, yeah.
probably be
No.
in denial about being depressed.
No, somebody who came to see you,
They
but-
might be blaming other people for the depression and not really
Right.
wanting to take a deep, in-depth
Yeah, how do you
look,
turn that
but-
around?
Well, it's part of the magic.
The magic.
It's part of the magic of
the
therapy,
magic.
sweetie. Yes. Yes.
So, okay, well, we do have a couple minutes left, but I've been over on my last couple of shows. And I
What
think
does
we
that
need to
mean?
go
Are
have some
we-
chocolate.
Oh, absolutely. At the very least.
So I think we're good. But I do want to thank you for coming.
Thank you for having me.
And I'm glad we're still smiling at the end of this.
I know. Well, I'm a smiley person.
So,
you know,
okay.
unbelievably.
And actually, in the process, I did remember who my next guest is
Who
going
is
to
it?
be.
Pray tell.
We are going to have 2 guests and the first ever live studio audience for Something to Talk About.
Here?
Here, we're going to have a live audience. I am having a returning guest. Anya Kennedy is a lawyer who helped me and my husband plan our estate and plan what to do in the event that something would happen to us. What do we do with our kids? And Stuart Papp is a financial advisor. So the 2 of them are going to have a panel discussion with our live studio audience, and we are going to talk about planning for parents with minor children. So not only is it the depressing part of what happens if you pass on, you know, who's going to take care of your kids, finding a legal guardian, how to determine that, questions that you need to ask in identifying that, but also questions for when you're still around. How to plan for college. You mentioned you have 4 children. Okay, each college tuition is probably, you know, per kid is $200,000, $300,000 over the course
Dear
of,
Lord.
you know, over the course of 4 years. You have 4 kids. Where are you going to come up with $1 million to send your kids to college?
No.
So that's what they can answer. So if
That's
anyone
great.
is interested in being in our live studio audience, they can email me at talk@bcattv.org and reserve your spot and have all of your questions answered. Free advice. What more could you
Absolutely.
want for that?
That sounds fabulous.
So, okay, that was my little plug.
Nice.
But I do want to thank you for coming.
Thank you for having me. It was very
And
fun.
hopefully we will have you back. Talk about something more
I would
cheery.
love to.
So, we'll have to find something a little cheerier.
Oh, okay.
Or one of us will have to learn how to juggle to kind of, you know,
Do
comic relief.
something. Absolutely, yeah.
So, and I do want to thank everyone at home for tuning in and listening to me and my lovely guest, Cheryl. And I hope you have a wonderful week and try to stay warm because it's really bitterly cold out
awful.
there. You can't even build a snowman, so don't even bother trying. Have a great week and good night. Thanks.